name is Thomas. Welcome to the show. In this video, I'm going to be introducing you to some specific exercises you can be performing when you have Bell's palsy or facial palsy. And this is a plus for you watching as a physiotherapist, because these exercises are tried exercises and they are producing good effects to patients who present with Bell's palsy and facial palsy. And I want to highlight them to you in this particular video so that you can incorporate them in your therapy when you are dealing with patients that present with Bell's palsy or facial palsy. Now, Bell's palsy and facial palsy causes unilateral facial paralysis. And so when you have Bell's palsy or facial palsy, you are definitely going to have one side of your face deviated. Okay, you have either mouth deviation, and there are various impairments associated with this whole thing we are talking about. And you have to get to know some key protocols that can help you as a therapist to be able to help those patients. The idea behind the whole deviation we are talking about today is that, for example, if you have facial palsy around this area, there is obvious weakness in the facial muscles around here. So the muscles here are strong enough. As a result, it causes the muscles here to be able to pull the muscles here towards itself. So there is going to be left facial deviation, and your mouth will be deviated to that side, like this. The two conditions do not just occur like that. There is an underlying problem causing it, and that is related to the facial nerve, which is the seventh cranial nerve. The seventh cranial nerve is a nerve that innervates the facial muscles, especially facial expression muscles. Okay, and most of these muscles are the muscles that hold the mouth and hold the eye and help us to make facial expressions and other things that we use the face for. Okay, yeah, so basically if the facial nerve is having a problem, the innervation is impaired, and so motor impulse and sensory impulses become impaired. So the nerve particularly will not be able to supply the facial muscles well, and the muscles tend to be weak. As a result, if it happens that the weakness is on the right side, the facial muscles here will be strong enough to pull the muscles here to itself, so the deviation will go to the left. However, if the affectation is here, the deviation will go to the other end. You understand? And so when that happens, it can cause you to be drooling, whether you are salivating from the affected parts, because these parts of the mouth will not be able to close well. And when you are sleeping too, this eye will be left open. Some of these things can be very embarrassing. Okay, so we need to work on it. And another major problem you need to also take note is that your speech can be impaired entirely. Your speech, because there is asymmetry in the mouth alignment, it affects your speech. You can be talking, you see. Yes, so we need to intervene. This intervention would basically involve physiotherapy, because physiotherapy would have a lot of protocols for you to strengthen your facial muscles that are weak. Okay, and these protocols that physiotherapy may utilize would either involve facial exercises and some departmental based exercises like electrotherapy and even kinesiology taping. These exercises are tried exercises and they are effective. Patients give positive feedback on them that these exercises are helping them. So now let's switch to the exercises. The first one is puffing of the cheek this way. So as the patient is made to do that, there is going to be a challenge on the affected part, but the idea is that as the patient tries doing it, it revives the muscles that help in puffing of the cheek, which can also revive the affected muscles. So we puff the cheek Okay, and the second one is wrinkling of forehead. So there should be lines created. However, if the affectation is here, this side will not be able to, the lines will not be visible, but this side, which is not affected, will be visible. So the patient needs to keep on trying them. You can also ask the patient to close the eye tightly. Okay, so the idea is that as you are involving the patient in doing some of these things, it engages the muscles that help in performing some of these activities. Okay, so the patient is utilizing the muscles actively. The next one is whistling. So patients often have challenge with the whistling because there is deviation in the mouth. So it will be like, okay. The next one is you can also ask the patient to frown the face. Okay, this is by force frowning. If you don't know how to frown your face, you are definitely going to know how to frown your face when you have Bell's palsy or facial palsy. So the next one is frowning of the face. And then you also make the patients try to look surprising, as if there is surprising thing the patient has seen. And the last one has to do with eye movement, incorporating things that will facilitate eye movements. In order to perform this thing, you have to make sure you stabilize the head midline and you only move the eye accordingly. So watch me closely. I'm going to stabilize my head midline and I will only be moving the eye. So watch me closely. Watch me closely. I'm going to look top. I'm going to look down. I'm going to look left. You see the eye movement. I'm going to look middle. I'm going to look right. So you can see I'm not moving the head, but the eyes are moving. Okay. Yes. Midline. Left. Midline. Right. Top. In that order. Okay, so basically these are some of the exercises you can engage your patient in when they have Bell's palsy or facial palsy. They are tried ones and they are effective ones, of course. Patients often give positive feedback when they engage themselves in performing some of these exercises. So try these exercises along with electrotherapy and kinesiology taping and some other facial massages you do for patients who present with Bell's palsy and facial palsy. Thank you so much. I will leave you to enjoy the rest of your day. But if you haven't subscribed to this particular channel, kindly do so by tapping on the subscribe button down below. Don't also forget to give us thumbs up and don't also forget to give us your comments. Thank you. Bye bye.